Hello, my name is Pauline RN. Welcome to my channel. The title of my video is Assessment and Diagnosis Part 3. I have a video out there on assessment and diagnosis. I have a video out there on Part 1 and Part 2. This is Part 3. And this is question and answers, assessment and diagnosis. My first question is, when formulating a nursing diagnosis, the nurse examines what? When formulating a nursing diagnosis, the nurse examines what? The correct answer is the functional health pattern of the patient. We were just talking about functional health patterns of your patient in my previous video, Part 2. So when you do your assessment and you gather all your information, subjective data, objective data, or focus assessment, what brought this patient here, abdominal pain, chest pain, we focus on what's causing the problem. We do a head-to-toe assessment, and assessment is first, nursing diagnosis is second, AD, and before we can do a nursing diagnosis, we have to do assessment. And before we do nursing diagnosis, we have to assess, as we just say, the functional health pattern of our patients. What was this patient's function at home? Was the patient a total carer, assist patient? What was the function? Was the patient ambulatory? Okay, the next question is, the nurse have to analyze the assessment data in order to develop what? The correct answer is the nurse have to analyze all our assessment data in order to develop. The correct answer is a nurse's diagnosis. You have to analyze all your data, all your assessments first. After you analyze, you record your data, focus assessment, subjective data, objective data, developmental of your patients, whether it's a child, adult, senior. We have to do focus assessment. You have to do all the analyzing of all these data before we can do, in order to develop our nurse's diagnosis. Next question. Both medical and nursing diagnosis are required for what? The correct answer is to treat patient's problem. So your patient is coming from the emergency room, of course, with a medical diagnosis from the doctor. The patient is admitted, immediately the doctor is writing that medical diagnosis so the nurse can know what the medical diagnosis is when she received the patient. So both medical diagnosis and your nursing diagnosis, which is done after you analyze all your assessment data, nursing diagnosis and medical diagnosis is required first in order to treat the patient's problem. Medical diagnosis and nurse's diagnosis are required to treat the patient's problem. In order to get the nursing diagnosis, you have to assess first. Gather all your data. Next question. What is risk diagnosis? When you have a diagnosis, we say patient is at risk. What is risk diagnosis? The correct answer is case in which client is vulnerable to develop health problems. Patient is at risk. The patient has not developed, at risk for injury. This patient is at risk for injury. Could be one of your nursing diagnoses. It has not occurred as yet. So your risk diagnosis is a case in which client is vulnerable. This patient needs a walker or a cane. This patient needs standby assistance. This patient is vulnerable. Next question. What does it mean? What is a nursing diagnosis? What is a nursing diagnosis? The correct answer, health issues that can be prevented. Nursing diagnosis, health issues that can be prevented, reduced, resolved, enhanced through independent nursing measures are your nursing diagnosis. Next question. What is etiology? Etiology is cause. Etiology is cause. What is related to? What do we mean by related to? The correct answer is related to refers to what caused the problem. Related to refers to what caused the problem. My next question. Diagnosis is based on what? The correct answer, nursing assessment, objective, subjective data. So your diagnosis is second. Your assessment, sequential, ADPIE, assessment is first. Diagnosis is second. So diagnosis is based on your nursing assessment. All those data you collected, functional data, objective, subjective, focus assessment, all your data together, medications, vitamins, all your assessment, then functional data, everything, all your assessments, your nursing diagnosis is based on your nursing assessments is the correct answer. What are patients' problems is the question. The correct answer, patients' problems are actual problems or potential problems. When we say potential, we say risk. Patient is at risk for injury. This patient is 92 years old, jumping out of bed. Maybe we're going to have to restrain this patient. It's a new admission coming from the nursing home. So one of our diagnoses would be risk for injury. So patients' problems are either actual problems or they can be potential problems, risk. Another question, goals should be what? And the correct answers, goals should be realistic goals. Implementation should do what is the question. Implementation should do what? The correct answer is change your patient's outcome is the correct answer. There's another question. What are your nursing diagnoses? The correct answer, your nursing diagnosis is related to the health problem of your patient. Your nursing diagnosis is related to health problem. Your diagnosis is problem that currently exists. What is risk diagnosis? Another question. The answer is problem client is at risk for developing is the correct answer. Next question. The nurse describes the components of a nursing diagnosis as. The nurse describes the components of a nursing diagnosis as. Correct answer, defining characteristics. 1. The nursing diagnosis, the nurse describes the components as the problems that the patient has. The nurse describes the components of a nursing diagnosis as the etiology or cause. Another question here. In order to identify your nursing diagnosis, the correct answer, use best data collection. 1. In order to identify the nursing diagnosis, use body system mode. In order to identify your nursing diagnosis, use body system mode. Head to toe assessment. Focus assessment. What brought the patient here today? And there's another question. What is body system model? What is body system model? The correct answer, body system model introduces a holistic database that is useful in identifying your nursing diagnosis. Your body system model is a holistic database that is useful to identify your nursing diagnosis is the correct answer. What is the purpose of a nursing diagnosis? What is the purpose of a nursing diagnosis? The correct answer is to identify your client's problems and etiology, cause. The purpose of the nursing diagnosis is to develop a care plan. A care plan. The purpose of a nursing diagnosis is to analyze our data is to analyze our objective data. The purpose of a nursing diagnosis is to identify health problems, to identify risk, to identify strengths of the patients. Next question, what is a nursing diagnosis? A nursing diagnosis is response to actual and potential problem. That's your nursing diagnosis. When we say as evidenced by, what does that mean? As evidenced by refers to what? As evidenced by refers to, shows you how you know there is a problem. Signs and symptoms presented is your correct answer. Next questions. What are your presenting problems? What are your presenting problems? And the correct answer, your presenting problems are all the data you collected. Your objective data are your presenting problems. All your diagnostic, your vital signs, your height, your weight, your functional assessment of your patients at home. What were they doing? Were they able to care for themselves independently at home? We do focus assessment. What brought you here today? Abdominal pain. So presenting problems are your objective data. Objective data. Please note, there is a questionnaire. There is no evidence by in risk. Why? There is no evidence by in risk. Why? And the correct answer is, it has not happened as yet. The patient is at risk for falls. It has not happened as yet. There is no evidence by in risk. Why? The correct answer, it has not happened as yet. And this ends to part 3 in assessments and nursing diagnosis. Hope you learned something from this video. I had to come back and do the questions and answers that you would understand everything that was in my first video. Have a blessed day. Thumbs up, subscribe, and please share this video. Stay tuned to my physical assessment tips. There's a video out there, and I'm getting ready to do the questions and answers on my physical assessment tips. Stay blessed. Have a good day. Thank you.